we need to understand clearly that psychiatry as a discipline is an evil that we need to get out of our lives. We need to understand very carefully that psychiatry is not something good. It is not true. As usual, we are not going to speak. We are going to allow the psychiatrists, the doctors, the institutions, the experts themselves to speak to you, to show you the real facts about psychiatry. None of these clips here are copyrighted. They can all be found on the internet. You can look them up for your own selves. However, what we want to show you, the basic points we want to show you about psychiatry from evidence are these points. Point number one, it is not a true science. It is not something scientific as other things are. Point number two, it cannot be scientifically proven. You try to get various means to show proof that the mental diagnosis given by psychiatrists and the fact that there are mental illnesses based upon imbalance of brain chemicals, this cannot be proven to be scientifically true. Even though some psychiatrists send you for brain scan to give what we call a scientific ear to what they're doing, these brain scans prove nothing. They cannot identify psychiatric illnesses. Point number three, the whole thing about psychiatry, it is that it is a money-making trade. Billions of dollars are made from diagnosing people and giving them psychotropic drugs. It's a business making billions of dollars over the years. Point number four, it gives dangerous, psychiatry gives dangerous psychotropic drugs to patients that causes dangerous effects to the mind, mind-altering experiences, and even causes murder and suicide in some cases. These things will be proven to you actually from the clips that you're going to see here on this program. And point number five, psychiatry takes away your rights and freedoms, and so that a person can be committed to a mental institution without their choice, without real evidence, without a trial. These are the things that are going to be shown to you as you look at these clips here. So may God bless you as you continue to view.
Everywhere you look, there it is. Think psychiatry has nothing to do with you? Think again. The whole field of psychiatry has gotten into every facet of your life.
They basically believe that everyone is mentally ill.
You smoke too much, it's a disease. You're too unhappy, it's a disease. You're too thin, it's a disease. You're too fat, it's a disease.
Where are these coming from? These are coming from the minds of psychiatrists that are dreaming these things up, writing papers and getting published with their names on it, creating these new diseases.
First he said that I had ADD. Then he said that I was depressed. Then he said I might be bipolar, but I don't have ADD anymore.
And he said, you know, I've been noticing you, and I wonder if you have it too.
What they decided is that both my husband and my son had a chemical imbalance that needed to be corrected with a chemical balancer.
There is not one shred of credible evidence that any respectable scientist would consider valid, demonstrating that anything that psychiatrists call mental illness are brain diseases or biochemical imbalances. It's all fraud.
There's no reliability of diagnosis, and there is no science. It's just pseudoscience. It's pretend science.
This is one of the most open secrets in all of America in the psychiatric field, that nothing is being done that's legitimate, and they're billing for it.
Psychiatrists claim that over 1 billion of the world's population is mentally ill. In the past 30 years, they have prescribed psychiatric medications to 543 million people. And right now, they drug 17 million school children with stimulants and antidepressants. When recently asked about the scientific basis of their profession, those psychiatrists willing to be interviewed offered nothing but excuses.
Psychiatric illness is not really illness.
How do you evaluate if someone is cured or sick?
Cure is certainly something we look forward to. We had no earthly idea how to accomplish.
We're not good at causes. We don't know what causes mental illness.
But that hasn't stopped them from pronouncing themselves mental health experts.
There's no such thing as mental disorder. A mental disorder is whatever someone says it is, and if the person saying this is a mental disorder has enough power and influence, then people believe, oh, that's a mental disorder.
But you can't have power or influence without credibility, so psychiatry manufactures its own.
It's based on a grab bag of checklists for disorders that are published in a book called the DSM, which is the Diagnostic and Statistical Manual. There are no statistics in this book, by the way. That just makes it sound more scientific.
They create this cluster of disease, and they get together and they vote. Is this a disease? All in favor say aye.
It's marketed as a scientifically based document. Now, the American Psychiatric Association, which publishes the DSM, do a lot of work to create an aura of scientific precision around the DSM, but it's not scientifically based.
Since the first edition of the DSM, the number of mental disorders voted into psychiatry's diagnostic manual has grown to 374. And with each new disorder, psychiatrists create yet another way to defraud the public.
If you have 27 ways to bill in the DSM, that's 27 ways to bill. If you have 300, that's 300 ways to bill. So you can pretty much find anyone walking on the street that could fit into a DSM somehow.
When you build insurance companies, you can't say the word. You've got to send in a number. And they have numbers for the most ridiculous things. You know, like arguing with your mother or peeing in the bed.
Adolescent rebellion disorder is an official psychiatric diagnosis. Arithmetic learning disorder is an official psychiatric diagnosis. General anxiety disorder is a recent diagnosis.
For each one, there is a 5-digit code with a decimal point. Now, the implication of that is if I have illness 403.16, that's different in some important and scientifically proven way from someone who has 403.17. And nothing could be further from the truth.
Incredibly enough, while presenting the DSM to the world as scientific fact, psychiatrists freely admit its utter lack of science.
We have no diagnostic reliable markers for almost any illness there is in the DSM.
What we're testing for in psychiatry, it's hard to say because there's nothing specifically.
But as far as a test that's clinically useful, basically we're not there yet.
We don't have any laboratory tests that we can use to determine whether somebody does or doesn't have a mental illness.
There are no good biological tests for detecting mental illness.
There is no test, there's no biopsy you can do.
There is no chemical test right now.
There are no specific tests to confirm the diagnosis or show the improvement, like any blood tests or any x-rays or anything like that.
Oh, in my practice I don't do any tests. I just speak with people and listen to them, and then I make a decision in what kind of illness.
We don't know if I give you a medication if it is going to work or not.
To a certain degree it's trial and error.
You never know if it's the right drug.
How many people have I cured? Well, there are no real cures right now in psychiatry.
I have cured none of my patients.
We're always challenged by our lack of knowledge.
I mean, in fact, we don't know what the causes of mental illness are.
Most mental illnesses, we do not know the cause.
Of course, it would be nice to know exact reasons of disorders, but maybe in the future.
I'm the Director of Research at the American Psychiatric Association. We don't know the etiology of really any of the mental disorders at the present time.
We have swallowed all manner of poisonous certainties, fed us by our parents and school teachers, If the race is to be freed from its crippling burden of good and evil, it must be psychiatrists who take the original responsibility.
Brock Chisholm's declaration typified the psychiatric onslaught aimed directly at our school system.
They actually said that the purpose was social control, not to pass on knowledge, not to give him something so that he can go into the world of work.
In 1950, psychiatrists and psychologists from around the world met at the White House to propose a total reorientation of the public school system.
The White House Conference on Mental Health in the 1950s was a landmark that served to bolster the idea that schools would serve their communities better as mental health clinics than they would as institutions of learning.
In the early 60s, the world of psychiatry started to really go places in this country. Little by little, it came into our schools, our educational system.
And by 1965, it was written into law. Psychiatrists were given the green light for the wholesale labeling and drugging of school children.
A child is labeled ADD or ADHD the minute he can't sit still for a 10-15 minute period of time, or he talks constantly or ignores the teacher completely. That will get him and earn him an ADD or ADHD label.
The labeling of attention deficit hyperactivity disorder, ADHD, went into full swing in 1987. Within 1 year, 500,000 American children would be diagnosed as ADHD. By 1994, that number had soared to 4.4 million. In response to widespread public alarm at this apparent epidemic of mental disease, the U.S. government-funded National Institutes of Health assembled a panel of prominent doctors and psychiatrists to explain to parents and educators exactly what ADHD was.
I would like any member of the panel to describe a typical ADHD in terms of symptomatology. Mark, would you like to? Since you see them in your practice.
I think the panel has been frank, and the difficulties here are immense in terms of these. It is hard. It's very hard to know how to answer this question. They cannot, even when they are as if driven by a motive. There are some good clinical descriptions. And I think, I think part of the problem is the profession keeps changing the diagnosis.
At this time, we do not have a diagnostic test for ADHD. Therefore, the validity of the disorder continues to be a problem.
But this shocking admission did not stop school psychiatrists. 2 years later, the number of American students diagnosed with ADHD had shot up to 6 million. Today, 20 million children worldwide are labeled with some form of learning disorder, a diagnosis often made in a matter of minutes.
We would sit behind a two-way mirror along with the parents. We would then look at the child. We would do small manipulative activities with them to see where their deficit was. It was wrong what we were doing. We were looking at a 5-minute glimpse of this child's life and saying, okay, here you go. Here's a little pill, take it, you'll be fine.
Those little pills like Ritalin, Adderall, and Concerta are classified by the U.S. Drug Enforcement Administration as highly addictive substances, right along with cocaine, heroin, and methamphetamine. To enforce their authority over others and keep their institutions filled at profitable levels, psychiatrists use a method called involuntary commitment.
When you go to a real doctor, say a family doctor or a cardiologist, a patient always has the right to refuse treatment. So there is no such thing as involuntary treatment when it comes to clinical medicine as practiced by real doctors. Psychiatrists, of course, believe that people can be treated against their will.
In 1956, psychiatrist Winfred Overholser presented a plan to Congress intended to take involuntary commitment to a whole new level. The plan: purchase 1 million acres of Alaskan wilderness, build a huge mental asylum, and change the commitment laws so that anyone could be shipped off with no more than a simple nod from a psychiatrist. The bill sailed through the House of Representatives, but when the public caught wind of the plan, they became enraged, referring to it as Siberia, USA. The bill was quickly struck in the Senate. But while the death of the Siberia bill put a stop to their large-scale plans, involuntary commitment still remained the most effective and profitable method for filling psychiatric institutions.
Again, the person has committed no crime and has no trial and is sent directly to a mental hospital, which is really a prison.
He was on 5 different psych meds, Prozac and lithium, and he was 7 years old. And he was unable to function. He would have rages and then crying and all kinds of just violent rages, grabbing knives and all of this.
The list includes 15-year-old Kip Kinkle withdrawing from Prozac when he shot 22 classmates, killing 2 after murdering his mother and stepfather at his home in Springfield, Oregon. 18-year-old Jason Hoffman on Effexor and Celexa when he opened fire at his California high school, wounding 5. 15-year-old Sean Cooper on a mix of antidepressants when he shot students in Idaho. And 17-year-old Eric Harris on Luvox when he and partner Dylan Klebold killed 12 classmates and a teacher in the bloodiest school massacre yet, Columbine.
Psychiatry, in little more than a century, has infiltrated society on a global scale, and not by accident.
People aren't aware that in 1940, a prominent British psychiatrist, Colonel J.R. Rees, addressed the National Council on Mental Hygiene and set the agenda for psychiatry for the next 60 years. Since then, psychiatrists have been given authority in nearly every sector of our society, with tragic results.
We must aim to make it permeate every educational activity in our national life. Public life, politics, and industry should all of them be within our sphere of influence. We have made a useful attack upon a number of professions. The 2 easiest of them, naturally, are the teaching profession and the church. The most difficult are law and medicine.
Rees's colleague, psychiatrist G. Brock Chisholm, co-founder of the World Federation for Mental Health, later expanded upon psychiatry's plans.
To achieve world government, it is necessary to remove from the minds of men their individualism, loyalty to family traditions, national patriotism, and religious dogmas.
To implement their master plan, American psychiatrists convinced the U.S. Congress that mental illness was a national threat that only they, with vast increases in funding, could solve. And thus began massive U.S. government expenditures for psychiatric research.
In 2 Timothy chapter 1 and verse 7, we are told, "For God has not given us the spirit of fear, but of power and of love and of a sound mind." Yes, my dear people, God gives you a sound mind, and this helps you deal with psychiatric problems. Now, anyone who wants this program and the other one that we have said before, you can call us at 625-0446, 625-0446, and we would give you this DVD free of charge, and the other one about psychiatry, which was said before, free of charge also. And what you are seeing before the screen here are our various web addresses where you can look in and you can see our various studies and go through them and learn something to help you and to bless you. And remember again that psychiatry is fraud. It is not good. You don't need it. You need to be free from it. We will give you this DVD free of charge, and we will give you the other DVD free of charge, that you may be able to learn very, very well what we have said by looking at it for yourself. And until then, May God bless you until we meet again. In Jesus' holy name, amen.